some of this stuff. I worked in medicine for 30 years, and my specialty was infants and children. I worked in pediatrics clinic in Vienna, Virginia, and Children's Hospital in Omaha, Nebraska. So let's go ahead and get started. There we go. Maybe. There we go. Infancy and toddlerhood. Low birth weight is less than 2,500 grams, about 5.5 pounds. Anything below 5.5 pounds is considered low birth weight. Well, we'll talk about what the average or the normal weight of a baby is. Very low birth weight is less than 1,500 grams or 3.3 pounds. You can have a full-term baby that's born at 3.3 pounds. I've seen it. Usually it has to do with drugs, usually crystal meth or cocaine. Heroin will do that to a baby as well. Extremely low birth weight is less than 1,000 grams, 2.2 pounds, and that's just about the size. The problem is mostly that the baby's lungs aren't mature, and that's the biggest problem. Causes for low birth weight in developing countries, it's usually malnourished mothers and lack of prenatal care. In developing countries, cigarette smoking is another problem. Overall, multiple births, maternal age, and drug use all have to do with low birth weight babies. That looks like my niece, my great niece. Yeah, she's my great niece. When she was pregnant, she had pictures taken of her smoking and drinking and actually shooting up. She's just not real bright, I guess. Consequences of low birth weight, high mortality rate, of course. It's very difficult to keep them alive. They have to put them in an incubator with a lot of oxygen. The oxygen, you have to keep their eyes covered because the oxygen can destroy their optic nerve. Oh man, so you gotta make sure their eyes are kept covered. That's why they'll put stuff in their eyes. They'll cover their eyes. Low birth rate for small to date infants, poor maternal malnutrition, illness and exposure. Low birth rate for preterm neonates, inadequately developed physical systems, especially the lungs. Immature lungs, of course, and immune system isn't up to par at all, and the central nervous system, of course, isn't fully developed yet. Rates of low birth weight around the world. There you go. South America's doing okay. North America's doing pretty well. Asia's doing okay, and Europe, Australia. Places where there are problems, Africa and India. Treatment for low birth weight infants include kangaroo care, skin-to-skin contact for 2 to 3 hours a day, infant massage. Even with assistance, low birth weight babies are at risk developmentally. We do whatever we can. The average baby born in the United States is 20 inches long and weighs about 7.5 pounds. 95% of all full-term babies weigh between 5.5 and 10 pounds. That's really, really good news. That means only 5% of them are low birth weight. They are between 18 and 22 inches long. Firstborns tend to be lighter than laterborns. Boys tend to be slightly heavier and longer than girls. Boys average right around 7.5 pounds, and girls average about 7 pounds. The first few days, the neonate will lose about 10% of its body weight. A lot of its body weight is fluid. I'd say that. Most of the weight is fluid buildup that the baby accumulates in the uterus for insulation after birth and padding coming through the birth canal. So it's there for protection, so it doesn't really need it. It just needs it for insulation and protection. The baby will begin gaining weight back by the 5th day and are back to their birth weight by the 10th to 14th day. And there you go. Medical and behavioral screening 1 minute after delivery, and then again 5 minutes after birth. Most babies are assessed with the APGAR scale. APGAR scale is really kind of fascinating because, and usually, if I was ever in on a birth, it usually was because they were afraid something was going to happen with the baby, and they might need blood drawn from the baby as an emergency. Usually it didn't have to do with, well, sometimes it did. It had to do with uh, transfusion if necessary. You just never know. So if the APGAR scale, within the first minute, they'd always call lab tech down just in case they needed something. And we usually not have to do anything. Almost always, the baby came around and there was no problem. Of course, if there was a problem, they put him in NICU. Well, an infant's score may be affected by the amount of medication the mother has received. We didn't see that. We were in a Catholic hospital, and they didn't use very many drugs with the mothers. So we didn't see that very much. Neurological or cardiorespiratory conditions may interfere with one or more vital signs. So if there is any brain damage or if they have a problem with their heart, sometimes they'll have a hole in their heart, which is normal. Not normal. It's abnormal, but it's common. Let me say it's relatively common. And these are the famous blue babies. The APGAR scale was developed by the pediatrician Virginia Apgar with APGAR, a quick reference to determine the state of the neonate. A is for appearance. Are they blue? If they're blue, they get no points. If their thorax is pink but their extremities are blue, then they get 1 point. If their whole body is pink, then they get 2 points. Pulse, if their heart rate, if it's an absent heart rate, they get 0 points. If it's below 100, they get 1 point, and if it's over 100, they get 2 points. The look on their face, the grimace, the body attitude. If they look dead, then they get none. If they're moving a little bit, or their faces are scrunching up a little bit, they get 1 point. If they're crying, they get 2 points. Activity level, if they're limp, like they're dead, they get 0 points. If they are moving a little bit, they get 1 point. And if they're trying to punch you in the face, they get 2 points. Respiration, if they're not breathing at all, they get 0 points. If they are breathing to some extent, they get 1 point. If they're crying, they get 2 points. So you can see how we add these things up. Now this is almost instantaneous. The nurse will look at the baby. They will check the pulse to make sure that there's a pulse. And they will make sure that the baby's breathing. If the baby isn't, they'll do something. They'll do something to help the baby. We don't just let them lay there and 5 minutes later we check them again. That's not the way it works. They're constantly working with this baby, trying to get all these the APGAR scale up to 10, 2 points all over, and they'll do a lot of strange things. They'll prod them. They used to talk about the doctor spanking the baby, and of course that doesn't happen. They usually just prod them, and they're usually in the ribs, and they'll suction them, trying to pull all the mucus out of their throats, if there's any mucus in there. Anyway, you want them to start you want them to start yelling at you. Is what you want. And when you hear the baby cry, it's always great because that jacks them up to at least 4. And if they're crying, I can tell you that they're starting to turn pink, that's for sure. Anyway, all good news with crying. 98.6% of neonates achieve an APGAR scale of between 7 and 10 within the first 5 minutes of life. This is, you hardly ever see an APGAR scale that's lower than that. If there is, then they go out down to the NICU, and this is fairly quick. We don't let anyway, in any of the hospitals that I worked in, we didn't let them just lay there and watch them for a number of minutes. Usually, if you couldn't get the baby to start crying within the first 5 minutes, you send them down to NICU right away and let the NICU nurses deal with them, because the NICU nurses are very intense, and they get angry if everybody gets pissed off if something bad happens with a baby. Everybody wants all the babies to live and to be healthy and scream, and they want only good things for all these babies. My mother became a nurse so that she could, because her mother was dying of kidney cancer in her kidneys, toxic kidneys they called it, and but she said her favorite place to work, of course, was the nursery, and all the nurses she went through nurses training with, everybody wanted to. That was their favorite thing to do, was work in pediatrics or work in the nursery. So the nurses are really intense down there. Can't argue with that. Any score below 7 and the neonate is given assistance breathing, and they will, and it's instantaneous. They don't mess around. They don't wait to see if the baby starts breathing on its own. If it's not, if we can't get the baby to cry right away, then you will put a mask on the baby and start pumping oxygen in, with the bulb. We'll start pumping oxygen into the baby's face. Any score below 4 and the emergency measures must be applied, and that's, of course, when they take them down to NICU. If breathing is established or restored, no permanent damage may occur. You've got between 5 and 10 minutes before brain damage occurs, and this is one of the reasons why the respiration is the most important part. All this crying that we're looking for, that's exactly it. And we need to get oxygen into that baby's lungs. So here, let's watch a movie about the APGAR scale.
The APGAR score was invented in 1952 by anesthesiologist Virginia APGAR. It is a scoring system ranging from 0 to 10 and is calculated by evaluating the newborn based on 5 criteria. Each of these criteria can be allocated a score from 0 to 2, and then the sum of these criteria will give you the total APGAR score. In the original article published by Virginia APGAR, the original components of the score were color, heart rate, reflex irritability, muscle tone, and respiratory effort. However, there is an easier way to remember these criteria by remembering the mnemonic APGAR for appearance, pulse, grimace, activity, and respirations. Typically, the APGAR score is calculated at 1 and 5 minutes after birth. If the score is low, you usually repeat the score later. A score of 7 and above is generally normal. Scores less than 7 are low and suggest distress of the newborn that requires some intervention, for example suctioning or stimulation. Although APGAR scores are not used to determine morbidity or mortality, lower scores are typically thought to correlate with more severe outcomes. For example, scores of 3 that are persistent can indicate long-term sequelae such as neurologic damage. However, ultimately, the purpose of the APGAR score is to determine when emergent interventions are necessary. The APGAR score is as follows. You will take a look at the newborn's appearance. If they are blue or pale, you give them 0 points. Blue extremities but a pink body, you'll give them 1 point. And you will award 2 points if the body and extremities of the newborn are pink without any cyanosis. For pulse, if it is absent, you score 0 points. If the pulse is less than 100 beats per minute, you'll score 1 point. and in the ideal situation, the newborn's heart rate should be greater than 100 beats per minute, awarding them 2 points. For grimace, you award 0 points if there is no response to stimulation, or the baby is floppy. 1 point is awarded for grimace on suction or aggressive stimulation. And again, ideally, if the baby is crying on stimulation, you award them 2 points. For activity, if the newborn is not moving, you of course award them 0 points. If there's some flexion of the arms and legs, you award them 1 point. If there is active flexion against resistance, you award 2 points. For respirations, if they're absent, you award 0 points. For weak, irregular, or slow respirations, 1 point is awarded. And if the baby is strongly crying, you give them 2 points.
Okay. And there you go, the APGAR scale. Let me give you an example. Let me go back here. Let me give you an example. My sister was, my oldest sister, was very inactive almost all of her life. She was, I don't know, my poor mother. My poor mother was a nurse, of course, and she knew all this, and she knew that the baby was supposed to be moving. But my sister hardly ever moved when she was in the womb, and my mother was afraid that she would be born stillborn because she never moved. Kid never moved, and so when she was born, of course, they knocked my mother out to back. This is back in the 1940s. Actually, it was 1944. So they knocked my mother out to give birth, and she was a little afraid that she'd never get to see the baby because she wasn't sure that the baby was alive since she never moved. And the nurse that was in the I'm laughing about this in the delivery room that delivered my sister was a friend of hers, and she came to her later and she said, well, she was pink enough, but we couldn't get her to move. We couldn't get her to cry. So she kept scoring low on the APGAR scale. Her pulse was fine. Her respirations were okay, but she wouldn't cry. They couldn't get her to cry. And, of course, she was fairly, like I said, she was fairly inactive most of her life. But they couldn't get her to cry. They were afraid something was going on. There was nothing going on. She was a genius. So there you go. Medical and behavioral screening. The Brazelton Neonatal Behavioral Assessment Scale assesses neonates' responsiveness to their physical and social environment to identify problems in neurological functioning and to predict future development. We're looking for autism here. We're also looking for developmental delays, and that's what the Brazelton Neonatal Behavioral Assessment is. The baby is born with elementary survival reflexes that may reflect back to humans as more primitive creatures. And I'm going to show you a video of these primitive reflexes. This is from England. That's a newborn.
All full-term newborn babies are born with some natural reflexes, including sucking, walking, holding, and the startle or Moro reflex. If all these reflexes are present, the parents can be reassured that their baby's development is normal. This will not be the same in premature babies, as they still have some way to go. Following the birth of the baby, the midwife or paediatrician will check for these reflexes. Victoria's newborn Esme is being checked out by her midwife Andrea, and she shows how her legs already know how to move in a walking motion. Consultant neonatologist Ryan Watkins is checking over 3-day-old baby Tamami.
So you can see her legs are flexed and moving normally, and her arms are slightly flexed as well. It's a bit unfair to expect this one to flex too much given the weight of the cannula. And you can see, and she's a newborn baby, her central tone is low, so she arches over my hand. The baby who's a month or two old, you'd expect that to be straighter and her trying to lift her head. What I can do then is just check her Moro reflex, and to do this I just drop her backwards into the palm of my hands It appears a little bit startling, and startled reflex is another word for it. Whee! So you can see her fling her arms out to the side and open her eyes, and then they return to the normal position. If I open her hands up, place my pad of my thumb in the palm of her hand, and you should find that she quicks my fingers. And the same thing will happen on her feet. She's flexing her toes there. We can check it
Tell
separately
him.
while looking at this side too.
You can see that she's just had her blood drawn, probably for a PKU.
These reflexes will disappear over time as the baby develops and becomes stronger.
We talked about PKU last time. It's a waste product. Okay, the more or startle reflex, we saw that when he dropped, when he threw her down. He didn't throw her. He just let her fall backwards. When the baby is dropped or hears a loud noise, it extends its arms and legs and fingers and arches its back and draws its head back. The Darwinian or grasping reflex, when the palms of the hands are stroked, the baby will make a fist and is even able to support itself. Of course, he didn't pick up the baby. He just made sure that she was making a fist. The tonic neck reflex is when the baby is laid down, it will extend its preferred limbs in a fencer pose and flex its non-preferred limbs. It's trying to create a symmetry. It's trying to, if its right side is dominant, then it moves its left side to create symmetry in itself. The rooting reflex, when the mouth or cheek is stroked, the baby will turn toward the stimulation and begin a sucking response. The first time I ever went into a nursery, a nurse, strange lady, did this. She said, "Hey, watch this," and she put the baby next to her chest, and the baby turned its head and started trying to find a nipple to grab a hold of. She had clothes on, of course. Walking reflex, when the baby is held under its arms with bare feet touching a flat surface, it will make the step-like motions that look like coordinated walking, and we saw that in the film. When the baby is put face down in the water, it will lift its head and make well-coordinated swimming movements, as weird as that may seem. The Babkin reflex, when both the baby's palms are stroked at once, the mouth opens, the eyes close, the neck flexes, and the head tilts forward. The Babinski reflex is when the sole of the feet of the babies are stroked, the toes fan out, and the foot twists in as if it is trying to grasp a branch. Babies will sleep 16 to 18 hours out of every 24. Unfortunately, these are newborns we're talking about. Unfortunately, they only sleep in 4-hour sleep cycles, so rarely sleep throughout the night. The baby will not begin sleeping throughout the night until they are 3 or 4 months old. They will go on a schedule, as weird as that is. And maybe you've experienced this as well. I had 2 kids. My daughter was like on a schedule from the first minute she was born and would sleep through the night. She was wonderful. My son, wow, he was just all over the place. It really upset my wife. Don't tell my son, but I think that's why she left, because he was all over the place. After my daughter, of course, we thought, hey, this is a piece of cake, or at least my wife did. This is a piece of cake, but I'll tell you, when Chris was born, wow, all bets were off. You never knew when he was going to be awake and when he was going to be asleep. Approximately half of the neonates' sleep is taken up with REM sleep, a sleep pattern that mirrors being awake. REM sleep will decrease as the baby ages. At about 4 months, the baby will only be in REM for 40% of the time. By 1 year, the baby will be close to adult levels of REM at 25%. While most children will sleep peacefully through the night, many children will have terrifying dreams toward the morning that will wake them up and not allow them to go back to sleep. These are known as nightmares, and they occur in REM sleep and afflict females more frequently than males. Another sleep affliction is night terrors. Night terrors occur early in the sleep cycle during the deepest sleep. They occur most often to boys, and the child is difficult to wake and will not remember the incident in the morning. Why? Because they're in delta wave sleep. Sleepwalking is another problem that children sometimes will have. Sleepwalking occurs during the early night and deep sleep, so the child is hard to wake and will remember nothing in the morning. This happened to me when I was young. My brother, it was like 2 o'clock in the morning, my brother went downstairs and he woke me up, and he didn't mean to wake me up. He just woke me up, and so he went outside, and this was in the summertime, in the early summer, and there was a lot of dew on the ground. And here's my brother. He just sat right down in the middle of a field of dandelions, and he just sat down in the middle of it. And I couldn't figure out what he was doing, and I walked out to see what was going on. I didn't touch him or anything, because my brother and I didn't really get along a whole lot, very well. And I think we just had a fight not very long before that. So I just kind of went out, and he stood up. He sat there in the middle of this dew-covered dandelion patch for probably 10 or 15 minutes, and then he got up and he went back inside. Now the weird part was, so I'm walking around out there at the same time trying to figure out what's going on, and the bottoms of my pajamas were just soaked because the dew is pretty heavy. So we went inside, and he laid down in his bed, and I reached over and I touched his pants leg. He was dry as a bone. He was just dry, and I was wet. So I had to change my pajama bottoms anyway, and he wasn't wet at all. How did he do that? Well, he probably generated enough heat that it kept it dried out his pajamas enough. Mine were soaked because I wasn't generating heat. My feet were cold in that dew-covered area. Bedwetting or enuresis is a common problem with many children after they are potty trained. About 25% of 4-year-olds wet the bed occasionally, more boys than girls. Bedwetting tends to run in families, and boys a lot more than girls. Children grow faster during the first 3 years, especially during the first few months, than they ever will again. This rapid growth rate tapers off during the second and third year. By 5 months, the average baby boy has doubled his birth weight, and he will triple it by 1 year. By his second birthday, a boy will only add 5 more pounds to his weight. And this is my grandson, and that's my grandson. This is him as an infant, and this is him as a, 2-year-old, I think. A boy's height will typically increase by 10 inches in the first year to 30 inches. They will gain 5 inches in height the second year to 3 feet tall. A baby begins teething at 3 to 4 months, but they typically don't emerge until the 5th to 9th month. At 1, they will have from 6 to 8 teeth. By 2.5, they will have a mouthful of 20. And this is my grandson again, and this is me. And he's throwing snowballs in Denver. First time he'd ever seen snow. He was born in Florida, and this is the first time he'd ever seen snow. And there he is with all those teeth and blonde hair. I can show you what he looks like now. Wait a second. Wait a minute. There's his school picture from this year. You can see his hair is brown now. That's what he looks like now. There's a little monkey. There you go. Does he look the same? In the womb and after they are born, children develop from head to tail, which is known as cephalocaudally, and from the inside out, proximodistally, from the inside out and from head to tail. The head and the brain are the largest thing about the developing fetus and a newborn. At 2 months gestation, it takes up 1/2 the body length. At birth, it takes up 1/4 the body length. As adults, our heads are about 1/8 of our body length. And that's the way it looks if you're a little girl. As you can see, it's about half, about a third, a quarter, 1/5, 1/6, 1/7, and 1/8 of 25. There's a little boy, exactly the same thing. A little alien head there. Changes in body form. Genes interact with the environment. For example, nutrition and living conditions impact general health and well-being. Well-fed, well-cared for children grow taller and heavier than less well-nourished and nurtured children. Better medical care, immunization, and antibiotics have led to better health. And this is a family from the turn of the century, and this is a family from the 100 years later. Bottle feeding babies did not become possible until the 17th century in Europe. Before that time, if a mother didn't want to breastfeed her own baby because of inconvenience or the fear of sagging breasts, she would find another woman and have her breastfeed for her. This woman was known as a wet nurse. In the 19th century, an increase in infant deaths was blamed on wet nurses and bottle feeding. In the 1920s, bottle feeding once again became popular and didn't go out of vogue until the 1970s. Breast milk is almost always the best food for newborns and is recommended for at least the first 12 months. Parents can avoid obesity and cardiac problems in themselves and in their children by adopting a more active lifestyle for the entire family and to breastfeed their babies. Breastfed babies have fewer gastrointestinal infections. Recent research has refuted previous research that breastfeeding reduced the risk of allergies. It doesn't have anything to do with allergies. Breastfeeding for 3 months reduces the amount of wheezing in babies. This is no proof that breastfeeding reduces asthma later in life. Breastfed babies are less likely to develop otitis media, inner ear infection. That's the pus right there. Atopic dermatitis is a chronic inflammation of the skin. Breastfed babies are less likely to develop atopic dermatitis. Breastfeeding protects an individual from becoming obese throughout the individual's life. Breastfed babies are less likely to develop type 1 diabetes. Breastfed babies are less likely to develop type 2 diabetes as adults. Breastfed infants are less likely to die from SIDS. Women who breastfeed are less likely to develop breast cancer. Women who breastfeed are less likely to develop ovarian cancer. Women who breastfeed are less likely to develop type 2 diabetes than women who don't breastfeed. Women shouldn't breastfeed when they have an active infection that may be transmitted in the breast milk. This includes HIV, of course. A woman should not breastfeed if she has an active case of tuberculosis caused by the bacteria Mycobacterium tuberculi. They just had 2 deaths in Kansas due to a tuberculosis outbreak. A woman who is taking a drug that may be transferred to the infant in her breast milk should not breastfeed. In this case, this lady is chasing the dragon. That's heroin or opium on the aluminum foil. Taking hormonal birth control pills does not get into a woman's breast milk and therefore does not affect the baby. Selective serotonin reuptake inhibitors are expressed in the woman's breast milk and can cause lethargy, poor feeding, and fever in an infant that is exposed. Of the selective serotonin reuptake inhibitors, Prozac seems to have the most negative effects, and Zoloft has the least. Breastfeeding women who find themselves needing pain control can use the following medications: safely. Acetaminophen, which is Tylenol, ibuprofen, which is Advil, oral codeine, and hydroxycodone. Morphine and other methods of delivering codeine are contraindicated. Don't do it. The following drugs will cross into the breast milk of the mother and cause varying degrees of problems with a breastfeeding infant: marijuana, cocaine, heroin, phencyclidine, also known as PCP, and amphetamines. Alcohol readily passes into breast milk. Infants who ingest milk contaminated with alcohol will drink less milk and maintain a disrupted sleep pattern where they sleep for reduced amounts of time. Heavy drinking by a breastfeeding woman may cause a drunken effect from her infant, loss of pain sensitivity, deep sleep, inability to suck, and deep respiration. Women who smoke will have nicotine in their breast milk. In the past, it has been reported that nicotine in breast milk caused infants to have more respiratory ailments. However, new studies show that while it isn't suggested that women smoke if they are breastfeeding, there is no proof that there are any negative consequences. Nicotine levels peak at 30 to 60 minutes and take 3 hours to clear out of the woman's breast milk. The world has changed considerably since your grandparents or even your parents were children. The leading cause of death until the 1970s was still some childhood illnesses. Now diseases that used to devastate whole areas of the globe have been all but eradicated. Polio, measles, whooping cough, even chickenpox are no longer the scourge of youth. And of course, I lived through all this. I was born in 1949, and in the early 1950s, polio was killing people and was crippling people. This was really, really serious stuff. If we had come up with a vaccine for polio, who knows what the world would look like. It certainly wouldn't look like it does today. And that was in the early 1950s. One reason some parents hesitate to immunize their children is fear that vaccines, especially pertussis vaccine, may cause brain damage. Failure to receive vaccinations appear to be more deadly. 18% of the deaths in the developing world are due to preventable diseases. Vaccination has been so successful that smallpox has been eradicated worldwide. I had 3 smallpox vaccinations. I was vaccinated 3 times. The first time was to go to grade school when I was in 1955, and the second time was to go to college in 1967, and the third time was in I don't know the date. It was when I joined the Air Force. They didn't want me to spread smallpox to anybody. But since that third time, I haven't needed any more, because in 1969 was the last time they immunized people against smallpox. And I joined the Air Force in 71. But I went to places where there was smallpox, so they vaccinated me. I also got yellow fever, and oh golly, I got a lot of different immunizations. They just hit you with a needle all of a sudden. Immunization for better health. This is for babies. At 2 months, you get diphtheria, pertussis, tetanus, polio, influenza, and pneumococcal. In 4 months, you get the same thing: diphtheria, pertussis, tetanus, polio, influenza, pneumococcal, but they add hepatitis B. 6 months, diphtheria, pertussis, tetanus, influenza, and pneumococcal. At 1 year, it is influenza and pneumococcal. 15 months, measles, mumps, rubella, influenza, varicella. Varicella is chickenpox, varicella zoster. 18 months, hepatitis B, polio, diphtheria, pertussis, and tetanus. 4 to 6 years, diphtheria, pertussis, tetanus, polio, measles, mumps, and rubella. Rubella is measles, is another type of measles. One of them's the German measles, and the other one is, what's the other measles? German measles. No, I can't think of it. 11 to 12 years, they get a measles, mumps, and rubella. 14 to 16 years, diphtheria and tetanus. At birth, the brain weighs about 25% of its eventual adult weight of 3.5 pounds. By age 3, the brain will be 90% of its total size. By age 6, it is almost at its adult size. The brain's maturation takes much longer than was previously thought. Brain growth spurts coincide with changes in cognitive behavior. We learn languages, we have whatever degree of environmental stimulation we have. Specialization of hemispheres is called lateralization. The left side is for language, and the right side is visual spatial. The brain represents about 70% of the weight of the nervous system. The occipital lobe is for visual information. That's this one right here. Temporal lobe is hearing and language. That's the one beside your ears. Parietal lobe on top is touch and spatial information. And in the front is your frontal lobe. Higher level thinking such as speech and reason come from there. And this is supposed to be a joke, the brain, but where is Pinky? And that was a cartoon from Warner Brothers back in, I don't know, Pinky and the Brain. As you can see, they were mice that were experimented on. One of them is not real bright, and the other one is the brain. So he's really bright. Pinky and the Brain. Molding the brain, smiling, babbling, crawling, walking, and talking are possible due to rapid development of the brain, particularly their cerebral cortex. Plasticity is modifiability of the brain, and here we go. This is showing the plasticity of the brain and its growth. Throughout early life, the brain is creating more and more complex neuronal pathways. So the more stimulation you have, the more development that you will have, the more plasticity that you will demonstrate, and the more intelligent you will be. Even before birth, the brain is integrating neuronal coordination of muscle groups, a process known as integration. At the same time, select neurons are being developed to have a specialized structure and function, a process known as differentiation. When neuronal cell functions are no longer needed or no longer used, cell death occurs and the body prunes the excess brain cells if you don't need it anymore. Remember all those reflexes that you had as a baby? You don't need them right after. You only need them right after birth. So that portion of your brain that allowed you to swim and allowed you to walk, allowed you to fall backwards and flex. You don't need that anymore after you've been around for a while. So your body will prune all that stuff out. So now you can no longer swim. I mean, otherwise everybody would just take to paddling every time they got close to the water. But that's not the way it works. You have to learn to swim later on. Early experience can have lasting effects on emotional development and the capacity of the central nervous system to learn and store information. Sometimes corrective experience can make up for past deprivation. And of course, the problem is, this is a toddler's brain, and this is one that has had very little stimulation, and this is one that has normal stimulation. As you can see, this one is far more developed than this one is. However, just because you don't get stimulation at one point doesn't mean that you can't make up for that deprivation later on. Myelin, a fatty insulating substance, begins about halfway through the gestation in some parts of the brain and continues into adulthood in others. This accounts for improving abilities at various times during your adulthood. Babies first learn simple skills and then combine them into increasingly complex systems of action. Humans begin to walk later than other species, possibly because babies' heavy heads and short legs make balance difficult. One test that has been developed to chart motor development is the Denver Developmental Screening Test that charts a baby's progress and compares it to other children of similar age and gender. Denver. According to Thalen, normal babies develop the same skills in the same order because they are built approximately the same way and have similar physical challenges and needs. Not until babies can get around by themselves do they learn from experience or from a caregiver's warnings that a steep drop off can be dangerous. If there are chances to explore their surroundings, motor development is more likely to be normal. Some cultures actively encourage early development of motor skills. Giselle concluded that children perform certain activities when they are ready, and training gives no advantage. Findings do not indicate whether changes in the brain or in muscle strength, or both, are involved in motor development, but they do suggest that interaction of the biology and environment. And this is a picture of my blonde-headed grandson. There you go. There's a little guy. Here he is playing golf, and here he is playing soccer. He still does both of those, and he's really good at both. And this is his favorite food. Those are strawberries. By golly, if he's around, you got to buy the kids strawberries. Touch seems to be the first sense to develop. Pain experienced during the neonatal period may sensitize an infant to later pain, perhaps by affecting the neural pathways that process painful stimuli. A preference for pleasant odors seems to be learned in utero and during the first few days after birth. Preference for the fragrance of the mother's breast may be a survival mechanism. Newborns' rejection of bitter taste is probably another survival mechanism, since many bitter substances are toxic. And this kid doesn't like sour. That's a lemon. Some mean person has given that baby a lemon. Hearing is functional before birth. Auditory discrimination develops rapidly after birth. Hearing is a key to language development, so hearing impairments should be identified as early as possible. Vision is the least developed since at birth. Vision becomes more acute during the first year, reaching the 20/20 level by about the 6th month. Binocular vision is where the individual uses both eyes to focus. This leads to the perception of depth and distance developing at 4 or 5 months. And this is my grandson once again looking at his mom. An infant or a preschool child who fails to grow at normal rates for no apparent medical reason suffers from a condition called failure to thrive. About 6% of North American children exhibit this condition at one time or another, although not necessarily continuously. Hopefully not continuously. Failure to thrive may have many sources, both physical and psychological, and depend on both the child and the environment. And I told you about my sister who didn't move when she was in the womb. She may have suffered from failure to thrive to some extent, because she hardly ever moved. And she died young, or she died at 59. I guess I don't know how young that is. Anyway, she died at 59. And possibly, if she'd been a little bit more active, she would have lived longer. She wasn't fat, but I've seen these babies. This is a tough one because there's nothing wrong within them. They're getting stimulation from all different sources. Mom's trying to get the baby to do stuff. Dad's trying to they can't get them to eat. It's tough, and it just breaks your heart because this problem seems to be that they just don't have a spark to live. It's really weird. This is a real thing, failure to thrive. In recent decades, survival rates have improved in all regions of the world, but in the United States, there continues to be a disparity between different racial and ethnic groups. African American, American Indian, and Hawaiian babies have twice the infant mortality as other groups in the United States. Birth defects, congenital abnormalities, were the leading cause of infant deaths in the United States in 1998. Infant mortality for white Americans is around 6 per 1,000, while it is over twice as high among African Americans. Disparities in health care are considered the reason for the difference in the larger number of teenage women giving birth to low birth weight babies. And, okay, so what's the difference? Mostly health care. African Americans have a difficult time getting health care. American Indians, of course, have IHS. IHS. We have another, what is this from? 2018 statistics. Black, Native Hawaiian or other Pacific Islanders, American Indian, there we go. Hispanic, non-Hispanic, white, and Asian. Low birth weight babies are 5 to 10 times more likely to die from SIDS, sudden infant death syndrome, as normal birth weight babies. When an infant dies in a family from SIDS, later born children in that family have a 2 to 4 times greater probability of dying from SIDS. Infants who hold their breaths for 10 seconds or longer have sleep apnea. 6% of infants with sleep apnea die from SIDS. African American and Alaska Native children, Tlingit and Aleut, are 4 to 6 times more likely to die from SIDS. SIDS occurs more frequently in infants from lower socioeconomic circumstances. When there is smoke in a baby's house, they are more likely to die from SIDS. Infants who are put to bed with a pacifier are less likely to die of SIDS. When a baby is put in a bed with a fan in the room, they are 70% less likely to die of SIDS. After the neonatal period, death due to injuries are the third leading cause of death after SIDS and birth defects. Just under 1/4 of the injuries are intentional, homicide. The leading cause of death by injury is homicide. Other leading causes of death include suffocation, motor vehicle accidents, or choking on food or other objects. And that is it. Okay, I'll talk to you guys next week.